Senator Millett, Representative Cornfield, and distinguished members of the Education and Cultural Affairs Committee, thank you for the opportunity to speak with you today. My name is Dr. Zach Mazone. I'm a doctor of osteopathy. I am duly board certified in family medicine, both with the MD boards and with the DO boards. I teach at the University of New England in their family medicine department and osteopathic department. I also have my own clinic in Bath, Maine, where I live and work. I appreciate the opportunity again to speak with you. I'm deeply concerned about this bill, 798, and I'm urging you humbly today to vote in opposition to 798. Let me first state that my deep opposition to this bill is not so much over the hotly contested vaccine issues which we're hearing about today, but rather the fact that there's a deeper issue at stake here for me. My concern is that this bill profoundly violates the core principle upon which our country and Constitution is built. I hold this dear as I've served my country for 23 years in the United States Navy, and hold our constitutional rights dear because we fought for them, myself and my fellow countrymen. The need for self-governance is the core to what we are supposed to defend in our government. This principle is also the core upon which good primary care is built. The respect of the patient's right to choose is essential for good relationships with my patients. This is the essence of the concept of what is called informed consent. My responsibility as a doctor is to explain to my patients the risks and the benefits of any medical decision, to allow them to understand those risks and benefits and then to respect their decision. This principle states that for every medical decision, I must hold their choice as their final decision. It does not compel me to approve or agree personally with the decisions that my patients choose for themselves. Whether or not I personally approve or agree with the use of high-sugar diets, the use of alcohol, the use of tobacco, the use of cannabis products, or the use of medications or supplements is not as important as their right to choose. I am compelled to promote health as the government is compelled to promote health, but I am not compelled to mandate health as the government is not compelled to mandate in this, in my opinion. We as a nation, we as a state, need to refuse to allow ourselves to lose this essential right, even if our intentions are well-meaning. We should instead do what we are called to do as a nation, as a state, as doctors, and as citizens. We need to promote, not mandate, health. We need to have intelligent discussions about the risks and the benefits, and we need to respect the decisions that you've heard today. We definitely have risks involved with vaccines. I won't debate that. We have risks involved with the vaccine that you might take. Anytime I have this discussion, I talk about three things. Is the vaccination safe? Is it necessary? Is it effective? And we talk about each one of those points, and then it's important to allow somebody to choose what they're going to put into their body or the body of their child. I believe that everyone should be given this information about the risks and the benefits offered by vaccines, that all should have access to vaccines, and that all should have their personal freedoms protected to make an informed choice about what they decide to do with their bodies and with the bodies of their children. My concern today is that America has long been a place of religious freedom. Thank you. If we choose to lose that, we are choosing to lose philosophically, religiously, and I guess as well as we've heard today, medically, our ability to make our own choices for our health. So therefore, again, I'm urging you to vote no on this bill so we can continue to support all Maine citizens in their process of informed consent. Thank you for your time.
Thank you. Are there any questions? Senator Pouliot.
Do you have written testimony?
I do, and I've already submitted that previously in a written testimony form.
I'll find a copy of it, thanks. Okay. And just to clarify, did you say that you're a professor at UNE?
I'm an adjunct professor. I teach part-time at UNE, 1 day a week down there. I teach both in the family medicine department and in the osteopathic department.
Can you level with me, because I'm just a regular person like you? And I'm going to get chastised for asking questions because there's a lot of people here. But
sure.
So why such a varying degree of opinions from medical professionals about this issue?
I think it's very important to take a look at the idea of what you're focusing on. Let me give you a specific example. If we talk about the concept of measles risk, it's very real. There is a risk of measles. If you take a look at the risk and the concern for risk, what you would want to do is position yourself where you could avoid that risk if possible. If you're taking a look at the fact that no one's died from measles, then the actual risk is zero. but the potential risk is still there. And it depends on which side of this you're going to look at. If you're looking at vaccinations as immunizations, which they shouldn't be called, right, because they don't immunize your body, then you would be concerned. If you're looking at them as vaccines as additional benefit to avoid a disease, then you would look at it from the other side of the equation. So it really depends on how you're going to look at this. But the issue is that we have a very good law currently which says we want vaccines to happen. We believe it's best in the interest of our citizens to have vaccines. However, we have a philosophical and a religious exemption which allow people to make their own choices because very real risks happen not only from the disease, but as you've heard today, sometimes from the vaccine. And because that exists, we have to decide to allow the individual who might suffer the consequences, or the parent who's going to have to take care of the child that suffers the consequences, to be able to have the right of self-governance to say yes or no to that decision. I hope that answers what you're trying to understand. Yes.
Just as an update.
Any other questions? Okay. Thank you very much.
Thank you for your time.